Greetings. Hello, everybody. Here. I am, Sean Tiwanak. It's been about a month, and I'm alive. Yay! It's been really hard to decide whether to do this or not because so much has happened. What's up, Scott? Since I left for Dominican Republic, it's just like, where do I begin? It's so much happened, and there's so many things that. What's up, Pony? That I need to share with you guys. I don't think I can do it all right now in one shot, and so it's been difficult to find the right time to talk to everybody about, what I endured at the stem cell treatments, how they worked, some of the fears that I've had. It's been very different and kind of difficult, actually. What's up? But I want to let you guys know that despite any frustrations that I might have, or anxieties and the mental state, or whatever BS that I'm going through, I have to tell you guys this is the bottom line. The stem cell treatments have had an effect on me. What's up, Franz? Have changed my life. Okay, I have heard some things from mostly positive, but one of my medical doctors, it's a go nameless right now, was super negative to me, and I was afraid that maybe this was a waste of time. And trust me, it was horrific. What's up, Elsa? And Elsa, I have to tell you guys honestly, I'm a new man. I'm a different person than I was 1 month ago. You can ask Miley. She says, "You're not the same person when you left." We don't have any data yet. Okay, so I'm going to explain how everything's going to work in the next couple months. But what I can tell you is my concern initially was, did it even work? Yeah, was it worth the 60 grand? And the thing that's keeping me up at night is, did it work and was it worth the money? What's up, Mr. Hackbart? But I have to tell you guys, honest, it's working. The question is not, does the stem cell treatment work, but what are my results going to be? And you have to give it time. So that's the bottom line. I just want to start off. Robin, I've been thinking about you, Robin. This thing worked, you guys. Okay. Part of the reason why you haven't heard from me is because I've been having ups and downs and I was worried. Did it even work? Was it worth it? But I'm a totally different person. My whole experience of every day is different. In fact, it's changed my whole outlook on life. And let me be very specific. Okay, we talked about things like ejection fractions and all that. So, Daniel, but let's get down to the nitty gritty. We don't have objective results yet, but what I can tell you is subjective. How do I feel? Okay, shortness of breath is day and night. I don't have the same level of shortness of breath. I used to get short of breath if I'm laying in bed and I fall asleep for a couple minutes. Couple minutes now. Then no, I don't have that anymore. I can sleep couple hours without my CPAP machine. That's a big deal because I wasn't able to sleep at all, not even like for a couple minutes without the CPAP machine. I would starve for oxygen. Okay, now that's one thing. So there's like five things that I can tell you right now that has improved since I got this, and I feel like I look better. You hear it in my voice, it's more strong. Okay, so shortness of breath. The main thing is I feel like my heart rhythms are stable. Like I used to feel sick and dying all the time. Like I could go anytime. Like it was very traumatic feeling. But after getting the stem cell injections, about a week afterward, I promise you, I have this feeling like stability. Like I'm gonna be around. Like my heart feels stable. So over time, I should continue to get better and better and better. Yeah. So first of all, this working. The shortness of breath is much better. I'm not sweaty. Okay. My ability to sleep is much better. However, caveat, I've been so um, what you call insomniac lately, but it's all this because I'm worried about money and the future, and it's freaking me out because suddenly I'm like $70,000 in debt, and it was like, wow, I had no debt before, right? So, hey, Sean, right on. Okay, there's a few other things now. I'm able to do a lot more walking right now. Yesterday I went 3 times. So my physical activity has changed. I'm able to pick up heavier objects and not be like I used to just walk down the hall and just be super short of breath. Okay, so all these things in consideration, it's better. Everything's better. Okay, it's working. I was afraid it wasn't going to work because one of my doctors told me it was all a placebo effect and was BS, and that floored me. Okay, so it bothered me a lot because this was a tremendous ordeal. Hey, Kathy, I gotta tell you, the procedure itself, little bit horrific, but not as bad as other medical procedures that you might have endured. You know, like any kind of other surgery I've had is way worse. Yeah, it's just that I was. Hey, thanks, Kathy. So, anyways, what I'm saying is, its thing is working, you guys. Okay, so I'm 1 month out. On the 11th was a 1 month anniversary. So they're gonna have some ups and downs, and it's gonna go through stages. Okay, so 2 to 3 months. So by July 11th, all these changes should be permanent. Okay, and then by 6 months, October, November, we should see the peak, and by then we'll get some results. Now, just to give you an idea, okay, you know I like my charts and graphs, right? So yeah, let me show you something. Charts and graphs. Normal is like this 60%. So I just had a follow-up with Dr. Thanos of Zannos, Grekos. So how good am I going to get? So the stressful part about me is I like get out there and I think, hey, I should be all better already. Yeah, so Elsa, but you got to be patient. Yeah, because if you screw up, if I do like bad lifestyle decisions right now, I could ruin the whole thing. So Greg, so this is my level here, way down here. Okay. So the doctor set some good expectations for me. This is normal, yeah. Way the heck up there, 60, 50s, like that. That's normal. Okay, when you get to the 40s, then you get heart failure. Okay. Then when you go below that, then you get mild, moderate, severe. And then I was way down here in the basement. What's up, Melody? Okay, so beyond that, you're in a hospital. Yeah, it's a very, very dangerous realm because there's nowhere else to go. You're going to die if you get sick. Okay, and this is where I was. So the doctor said I should get into the 20s or the 30s. Now, it's still in the heart failure range. But if you look at it, I'm used to being way down here, yeah? So if I have a 10% increase, that's double already where I am at before. Yeah, so a little bit of an increase goes a long way. If you're normal and you get a 10% increase, you get a 10% increase. If I go from 10 to 20, then I get a 100% increase. You see, double. So anything that I get from improvements in this range is going to be a life changer for me. Okay, if I'm real fortunate, maybe I can get it to the 40s. Charlie, what's up, Charlie? Working, yeah, looking better, yeah. So anyway, this is setting the expectation, yeah. I could not gonna get back up to here, but I could get back up to these levels, which for me is drastically improved. So my whole daily quality of life should go right up. But then again, setting the expectation, I got to be very careful not to get sick and stay in a kind of a regimen of eating well, resting, and not getting stressed out for 2 to 3 months. So, like I said, by July 11th, that's my 3 month mark. So I'm setting that as a standard for me. And then October 11th, then we'll get some medical tests. Then I'll be able to tell you for sure, yes, I went up to 20%, 30%, 40% from where I was. Okay? So we have to wait till November. Okay? Now, what's up, Deborah? Gotta tell you guys, this stuff is magical. I'm telling you, so many different disease conditions are treatable. It's blowing my mind. If you have knee problems right now, you can, in the United States, get treatment with FDA treatment. The trick is the stem cells themselves. How good do they go? And I'm not going to keep this too long because I got a lot of catching up to do with you guys. It was very difficult to find the time to say, okay, now what am I going to do? Catch up. Because it was everything from the procedure itself. Now, it's taking a step back. These are the stem cells. This is what they look like. Yeah, so they extract that from your blood. And, okay, that is the worst part of the whole thing. Because they took out, I'll show you, all those vials of adipose tissue, fat, and blood. Yeah, so that came from my tummy, right to the belly button, and they took out like liposuction. And that is still recovering a little bit. It's got a little bit of hardness. I'll show you right now, I guess, but I don't know. Honestly, I was gonna do this on Saturday, but I looked at myself and I go, "Bro, you look ugly. Don't do it." Anyway, and then the other part is there's 4 injection sites where they went into the hip and they grabbed this bone marrow. Okay, so by adding these chemical or not neural, but transmitters that tell the stem cells to change, they've got 2 kinds of stem cells. Yeah, one is epithelial and one is muscular. So they're turning it into blood vessels and cardiac cells. And then when they end it up, you get this. All of that turns into that. Okay. Now, here's the interesting part. Oh, here's the doctor. Yeah. Just before going into the procedure. And trust me, a little bit horrific. Okay. But not as bad as anything else you could do. Yeah, this is the place where they did the procedure. So if you notice over here, there's a monitor. Whoops. Yeah, their monitor is what they are looking at. So if you look at this picture, you can see there I am lying down on the bed, and then there's a monitor. So this is there is no general anesthesia. So you feel it all. Okay? It's trippy. It just kept stabbing my heart. Okay, now let me show you what the needle looks like. Okay, so on this monitor is a little view of the needle. This down here is a defibrillator leading to my heart, and this here, whoops, let me find it better, is the tip of the needle. Okay? Taking a step back, let me show you. I'll keep this a little short because, you know me, I like science and stuff. So I'm going on and on and on. Yeah. Okay. So this is your body. Yeah. These are the arteries. So what they did is they made a puncture right there, and they ran the catheter up to the heart. So it goes through your upper thigh. And surprisingly, that was the easiest recovery part. But the out part, when they poked it in and there's no anesthesia, I thought I was going to throw up. Anyway, other than that, Bonnie. So they run that up, like I said, up to the heart. So it goes from here and run all the way up to the heart. And the interesting thing is, as they were doing these injections, like 30 of them. Later on, I'll show you some video of all this. I could feel electric shocks shooting down my spine to my hip. There was a point there that I thought I was going to pass out. Okay. And I had to hold the doctor's hand because I was like, at one point, I told him, I said, how much more is there? Because I didn't know if I could last anymore. These things, they're stabbing me in the heart. Okay. And I'm feeling it. And my heart's getting pissed off, like, and I thought I was going to pass out. And the doctor says, oh, about a quarter way done. I'm like, oh, damn. And I want to give up at this point. So I'm holding on and I'm feeling it shocking my back. Somehow the nerves are connected and bang, I'm feeling it, going to my spine. And then I just tell the doctor, I go, Sean, you can do it. Don't be a pussy. And then he looks at me and he goes, you know what, Sean, I'm glad you said it because I was about to say the same thing. After everything that we did and you guys supporting me and getting me there, the last thing I wanted to do was screw it up in the moment of truth. So anyway, they did about 30 of these injections throughout the heart. And again, these are the stem cells. Oh, no, these are the stem cells. Yeah. Those are mine. There were 5.7 billion stem cells. Okay. There's a lot. Because when you do a lot of these other stem cell stuff, maybe in the millions, 3-4 million. So it's all really boils down to the stem cells. And then again, this is the procedure room. Yeah. So that's me laying there. And I'm writing, right? I'm freaking out. But it's not as bad, the recovery, as anything else I've ever had, surgery-wise, including the defibrillator, way worse. The actual recovery of the stem cell part of it is nothing. Okay? So there's the doctor afterward talking, and I'm going to share more video later because he does talk about some really interesting things. So the chemical, what's going to happen right now? What's up? So what's going to happen right now is things are going to continue to evolve in the sense that more cells are going to come together to the heart area and they're going to start contracting together. And this work of contracting should make it smaller and smaller over time. So thereby, we'll go back to this, get me from here and start moving me up into this range. Yeah. So bottom line is I feel way stable. Like the rhythms of my heart, I just feel stable. I don't feel like I'm could just kick the bucket anytime. Because literally before I felt sick and dying, my heart. And I don't feel that way. Not at all. So I feel really stable. I'm having a hard time controlling some of my fluids and things like that because I think I'm on the wrong diuretic. But then again, the shortness of breath and the sweatiness, you can hear it in my voice. Yeah, much better. Now, a little bit of insomnia. My energy is up. I've been doing a lot more walking. Yesterday I did 3 times and I did a nice lap. So my whole day-to-day existence is completely different. Oh, by the way, I forgot to mention the swelling. I had problems with my feet being swollen for months. And about a week and a half after the procedure, my feet are back to normal, got veins and everything. So somehow it's been able to help, love you too, Kathy, help get the extra fluid out of my body. So my big goal is next week is my birthday, is to bring my weight down and continue on this path for 2 more months. And then the thing is setting realistic expectations, and I was getting frustrated because I wanted to do so much stuff with my life and I feel a lot of pressure with the financial and, because all of a sudden I got this big weight on me and I can't because I don't have that same level that I used to. And I really need to make sure that I do the right thing so I get the most out of it. Again, hey, the bottom line, you guys, is it's working. But the question now is how much improvement I can get. And that's the part that I have a lot of control over. My lifestyle, how I eat, the diet, exercise, and stress. Those things you got to all balance out. So for the next 2 months, I'm not doing anything. It's crazy, nothing at all. Real. I had some big plans to do some things, and I just got to pull back, focus on this health, and then we'll take it in the future, kind of where things are going to go from there. But there's a lot to share, you guys, and I'm going to be bringing more of that to you. It's nice to catch up with you guys finally because I didn't know where to begin. And to be honest with you, I haven't been in a good mental state because I've been not sleeping and trying to figure out what I'm going to do with myself. And, you know, initially I was wondering, like I said, I was afraid that it didn't work. You know, did it work? Was it worth it? You guys have supported me, and a lot of you financially even. This still need a lot of help with that. If that's something you want to help with, great. If not, you know, somehow we'll make it. But those things keep me up at night. But was it worth it? And you guys, the answer is yes. And I really have a lot of compassion for people who have, let's say, they cannot get a heart transplant, but they don't have the option to do this. So I'm going to try to do a lot to help other people receive the same kind of treatments I got. If you have questions about the stem cells in different uses, they even do respiratory with stem cells, which is shocking to me that they could treat COPD, lung disease, and hip disease, and spinal injuries, and all kinds of things. So you guys, this is really the future. I feel aloha Rio. I feel really good about it. Hey Rio, starting one ukulele thing. You should hit me up. But anyway, you guys, bottom line is it's working. Thank you, Leo. How's it? Thank you for all your support. I'm going to continue to do some more of these videos to talk a little bit more about the procedure itself, how it worked, what happened, and you know, I'm just happy right now that I have a chance to catch up with you guys. It's been difficult for me to get the courage. Like, where do I begin? So much happened from the day I got out of that procedure, and how it was like recovering the first few days, and then traveling, and then feeling good, and then kind of relapsing because you have flu-like symptoms initially, and then there's frustrations because you want to be better, like all the way better. But I have to admit, I am a different person today than I was a month ago. Okay, clearly. So even though we don't have hard numbers yet, which we'll get about the 6-month point, yeah, where I can share with you numbers that we have from tests, diagnostic tests, like ejection fraction, stroke volume, heart size, all those kind of things, then I can tell you for sure there had been an improvement of so many percent. But again, my shortness of breath, night and day. I can't sleep without the CPAP machine is nuts to me because I haven't been able to do that for like a year. You know, just wake up in a minute, just short of breath and gasping, and this feeling of just die, like your heart is just needs oxygen, starving. Yeah, oxygen. The energy level, the things that I'm able to do right now, carrying the water bottle and walking and doing different things is night and day. Again, the rhythms of my heart feel super stable. Good to see you too, Franz. And I don't feel like I'm sick and dying in my heart every day. I feel stable. I don't feel like I'm going anywhere, and now it's causing me to wonder what I'm going to do with my life and set some reasonable expectations on how to approach the next 6 months. And I think between the next 3 to 6 months, I have a more clear idea of where to head personally. And I don't know, to be honest with you guys. I'm lost right now. I'm not making any decisions. But I'm just going to kind of put one foot in front of the other, take care of one thing at a time, but mostly just make sure I get the best out of this, because this was a big ordeal and a huge financial ordeal, and you guys supported me. And I want to make sure I don't do anything stupid and jeopardize the strides forward that I've made. because in the next month or two, I could reverse that still. You know, the changes are not permanent until you get to the point where it's about, 6 to 12 weeks. Give yourself like 2, 3 months, then you become permanent, and that's what we need to get to that point. About 90 days. Okay. Anyway, thank you guys for hanging out with me. Appreciate it. I love you. Uh, stay in touch. Send me a message. I'm not always responsive because sometimes I'm just tired, man. Seriously, I push myself and I'm super tired. Um, so anyway, Mr. Nato, how's it? I'm just signing off. And you guys got questions about stem cells? You let me know. Because again, bottom line, guys, it's working. Okay, it is working. Now let's see how good we can get. Yeah. So we'll go up this continuum. We don't know yet. We're gonna go from 10% up to this whole area, hopefully. Okay. If I get super fortunate in the next year, I can continue to improve over the next whole year. So that's the point. And there's hope for you guys. See, that's the whole point here. Everybody has hope now with this kind of treatment, and I'm glad I went through it, and it was the right thing to do. And anyway, love you guys. Aloha oi till we meet again. And I'll be doing a few more of these with some video footage to show what the doctor said. And I got that, but one step at a time. There's been a lot to catch up on. Anyway, God bless you guys. Aloha.